Now, we have the privilege of hearing from our esteemed guests of honor, who will share their perspectives on the evolving landscape of healthcare and academia. First, I would like to call Dr. Shahid A. Merchant to share his insights.
Yeah, at the foremost, let me thank Dr. Karthik and Dr. Shrikant for this opportunity. So presently we've been working on advanced heart failure. And as we know, there's an epidemic of heart failure in the world, especially post-COVID. And unfortunately, 50-60% of heart failure patients would not make it at the end of 1 to 2 years. So we are coming out with all novel technologies to increase the longevity of heart failure patients over the next 15 to 20 years. Unfortunately, 35% of heart failure patients are in the pediatric age group, and this is a concern, and hence we detect fetal echocardiography and other kinds of management technologies, including devices and cardiac surgery for pediatric children with heart failure. We have created a AI algorithm for management of heart failure for patients to give them the exact management of heart failure. So we deep dive into the investigations and look at the etiology and the cause of heart failure. And we also plan on what would be the exact management in terms of treatment modality. It may be medical treatment, it may be devices, or it may be surgical management of patients with heart failure to give them more longevity to life. We've created an app which we call as a smart heart failure remote monitoring, and this app has got 20 parameters by which we monitor heart failure patients. So we have gadgets and we have a real-time dashboard in which we monitor heart failure patients by home monitoring, which helps us to detect any early deterioration in their cardiac conditions. We have created a lot of devices and other types of therapies, including heart failure devices which are related to structural heart disease, the left ventricular assist device, and the heart transplantation and the lung transplantation. You'll be happy to know that our group, which is headed by my colleague, Dr. K.R. Balakrishnan, we are colleagues for 35 years, and we have done the largest number of heart transplants and LVADs in India and in the Asia Pacific region. We also believe in innovations, and in the innovations there are two things which me and Bala look at. One is how to technologically improve our devices in heart failure patients, and also to reduce the cost, because the cost is a real problem for a large section of the world population. 99% of patients cannot afford the kind of devices which can improve their longevity. So we created our own LVAD, which is a motor unit which is elevated on a magnet, which has an inlet and outlet which is connected with a graft to the aorta to give blood supply to the whole body. This we finished our animal trials in Australia, in Sydney, and we got our C approval, and now soon we are going to start our human trials. We also have a company called FlowAid. I'm one of the directors of the company, where we have created a cat pump. The cat pump is a small micro unit which is a motor which we place in the left ventricle to rest the left ventricle when the heart recovers during a damage, to prevent and to protect the heart from heart failure. So this is one of the devices, the prototype of the device which we made along with the biomedical engineers. I presented at the Arab Health, and we soon, as I'm standing here today, we are starting our animal trials on the new cat pump. The cat pump which is available in the world is Impella, but it's 10 times more expensive than what we are trying to do, because we are trying to serve the heart failure community, which is very large numbers, and it's only growing because of the aging population, because of treated, untreated coronary artery disease, because of diabetes, hypertension, and because of structural heart disease. And the numbers are growing. So it's 250 million people in the world which suffer from the disease. But really, we have no answer because it's a very expensive technology. And me and my team and Dr. Bala's goal is to make superior technology at very, very affordable cost for the world. I also want to give this back to my next generation, and hence we've developed an academy which is the SAVE Academy. And this is a specialized academy in ventricular excellence, because heart is basically ventricle and we want to improve the ventricle. And so I created an academy to train the next generation, because unfortunately we don't have many advanced heart failure cardiologists in the world. So we'll have to create a legacy and create the next generation. It may be cardiologists, cardiac surgeons, anesthetists, nurses, technicians, biomedical engineers, because until we don't do this through the academy. So my academy and the course, which is a training course, is got a fantastic curriculum and the hands-on training. And fortunately, to my good luck, the Dubai Health Authority, I met the head of the Dubai Health Authority and she approved my course. And soon I'm going to get this course approved by the International Society of Heart and Lung Transplantation. When we have the next meeting, I'm on the review board of this committee, and we are going to meet in April to make it more formalized for the global international students to get enrolled in the training course. I also thank Swamiji for supporting us for the heart-lung machine, which we are creating, the first heart-lung machine, both for the adult and the pediatric, with Swamiji's contribution. We are working on it, which will be the first indigenous heart-lung machine, which will be innovated and manufactured in India, and I'm very, very proud for this. Lastly, I must tell you that me and Bala, we very much believe in Swamiji's thinking that it's one world, one family. And over the last 30 years that we have been together, our main mission has been to give our services and educate and treat patients globally. We must have conducted close to 150 camps together all over the world. And with CME and camps, we've educated a lot of doctors around the globe. We're surprised to know, though I was not there, but Bala went even to Palestine in Ramallah, and he conducted 35 operations in Palestine. This was in 2015-16 for the poor children of Gaza and the West Bank. Lastly, I must tell you that what is important is also the prevention and the revival of heart muscle and heart failure. So I have started a company which is on cardiac longevity sciences, and we are working on the mitochondria to release the ATP cells from the myocytes by different technologies with my European partners. And we have created some stem cells to regenerate and make the heart muscle to reverse heart failure. And we've also been working with Transcend company, which belongs to Mr. Burod, Dr. Burod, and this is basically on non-invasive methods, including intravenous nutrition and antioxidants and CoQ enzymes, selenium, zinc, and also ozone therapy and IV chelation. So these are other kinds of technologies which will help to reverse heart disease. So the future is also in the prevention and the reversal of heart disease and reversal of heart failure, because eventually heart is a pumping, it's a pump, it's a pulsating organ. It's the only pulsating organ which pumps 100,000 times in 24 hours. So how long will this keep pumping? So we have a lot of aging population now, and by the time they come to us, they are already in heart failure, and hence we are looking at how to reverse this, how to correct it, and if somebody already has got an end stage heart failure, how to give him the best line of management. So thank you very much, and thank you for your patient hearing.